Pawlenty is a big part of it. Governor Pawlenty joins us live. Good evening, Governor, and what's your plan for tomorrow night, sir?
Well, hi, Greta. Well, tomorrow night, myself and a number of other Republican governors are going to hold a teletown meeting outlining our concerns about the Obama health care plan, acknowledging the current system is broke. We need to do things to fix it and make this more affordable for Americans. But we also need to do it in a way that's respectful of consumers and individuals and not having the federal government take this system over. So those are some of the themes we're going to be touching on tomorrow night.
All right. In terms of the president's speech tonight, without going into what you would take, what you don't agree with, what would you add to it, or how would you change it? What's missing from his speech in your mind?
Well, I think the speech tonight, Greta, should be dubbed "Rhetoric Collides with Reality." What the president is asserting, the numbers, the math, just don't add up. You cannot expand insurance for 30 to 45 million people, for the people who are uninsured, make the insurance for all of us who have it even better, and do that for no additional costs or for having the deficit not be swollen. It doesn't add up. The rhetoric is colliding with the reality. He is not telling us how he's going to pay for it. I have to say he's being very evasive in this regard. And if you can save all of this money through Medicare savings and Medicaid savings, why aren't they doing it now? Then why don't we try that first as a sequence of things that might be considered or explored and see if those savings really materialize? And the answer is they won't.
All right. If you had your way and you were seeking to provide medical insurance coverage for those 35 or 40 million, where would you get the money, or how would you tinker with it to make this financially viable for the country?
Well, there's a lot of different things we need to do, Greta, but I'll just give you a couple of examples amongst 9 or 10 in the interest of time. Harvard University recently came out with a study that said that 30% of the medical care in this country is medically unnecessary. A large part of that is driven by the fact that doctors are afraid of getting sued. So we need to address that issue. A second thing we need to do is, if we are going to give people some financial assistance to buy insurance, we should do that to them through the form of a voucher or through the form of a tax credit, rather than having them have to come to a government panel or the federal bureaucracy to pursue that. Have them manage their health care rather than the federal bureaucracy. Those are a couple of the key themes.
Except that the voucher and the tax credit, that's going to cost us money. That may have some bearing in terms of freedom of choice or what people want to do in their lives. But a voucher or a tax credit, that's a cost.
Well, one thing we did in Minnesota in our state employee plan is to just start as a goal of slowing down the current system, having the costs slow down. So we said to our state employees, hey, look, you can go anywhere you want. You be in charge. But if you choose to go somewhere that has bad results and high costs, you're going to pay more. If you choose to go somewhere with good results, that it's more efficient, you're going to pay less. Guess where they go? And our insurance premiums in Minnesota have been 0% increases in 3 of the last 5 years, and the other 2 years very modest. So this isn't necessarily about just throwing more cash on the pile. It's about using the cash we have more wisely.
Well, let me ask you a question. The president said his program is going to cost $900 billion, and he also made some reference to tort reform, but he didn't seem to factor that in. Under your theory with the Harvard study and 30%, it sounds like if you incorporated what Harvard says on tort reform, that would now cost us $600 billion. Right or wrong?
And to be fair to the Harvard study, it wasn't just tort reform. It was also the capacity of the providers having more to do with whether the procedures get performed or not as compared to the health needs of the consumer or the patient. But notice the president said in trying to get rid of frivolous lawsuits against... But what about that $600 billion?
Let me ask you, though, am I wrong on my numbers? Yeah. Are we down to $600 billion? And if so, where are we going to get that?
Well, keep in mind he is enhancing benefits and privileges under this system. It's not just the status quo and knocking it down from here. He's not going to get it, Greta. He's not going to get it. That's the point. You cannot pay for this system and savings and waste and efficiency. If you could, why didn't they do that already? Why wouldn't you propose that first to see if it actually works? And so he wants to do little pilot projects on the things Republicans are most concerned about, but he wants to make sweeping changes on the things that are on his agenda.
And I should note that we even visited here and on the record a hospital in my hometown, and they've cut costs, I think it's like 25% in a year without jeopardizing quality, just by refiguring how they handle patient care. It's a very interesting program, so maybe everybody ought to look at that. Let me ask you a question. Tomorrow, or not tomorrow, but September 12th, Saturday, President Obama is going to be in your state. Did you know that?
I did, yes, and we welcome him to come.
You're going to talk to him? You're going to see him?
Well, I don't know. I think he's going to go to a rally or a big speech at a local arena on these issues. I think if he would let the states experiment and take the lead on this, we could do a lot with this. We know what he's proposing has essentially been tried in one state, and as it relates to slowing down costs, it hasn't worked. It's the most expensive health care in the country, and it's rapidly accelerating. To hold this model out as the solution for the whole country, it's not going to work, Greta. And he's selling us, I think, a bill of goods.
It's sort of interesting, though, from my vantage point, because September 12th is supposed to be a big tea party here in Washington, D.C. I don't know how many people are going to show up, but it's almost as like you sort of conveniently get out of Dodge and go to a town hall in Minnesota. I'd do the same thing, I must confess, but it's sort of interesting that we have no idea what the tea party is going to bring here, but it's going to be interesting. All right, your town hall tomorrow night. Any idea how many people are signing up for your tele-town hall?
Well, I think they're just starting to get that organized, and so I don't know if it's going to be 3,000, 5,000, 10,000, but I think it'll be that at least and probably more.
How do you sign up?
You just go out to the Republican Governors Association website. The information is on there, and a lot of people will be getting calls promoting it as well.
And I think probably now that we've told that, they're going to jam the phone lines. Anyway, Governor, thank you, and I hope you come back.
Okay, thanks a lot, Greta.